So I'll be the first to admit that learning the developmental milestones is one of the most challenging, and by challenging I mean frustrating things I had to learn in medical school. This video is for those of you who are like me. No children of my own, didn't grow up with younger cousins, and was too young to really remember when my little sister passed these milestones, if she ever did. Just kidding. The milestone tables out there are numerous, and just by looking at them, there appears to be no reason as to why milestones happen when they do. My job here is not to read you those tables, but rather it's to help you come up with an approach for memorizing these milestones. I'll also try to point out, in my opinion, what is the bare minimum of what you need to know to pass an exam and stay afloat on your pediatrics clerkships. Again, for the purists out there who believe in and can memorize long tables of information, this video is not for you. For the rest of you, let's begin. The best way to think about the milestones is first to eliminate all the extraneous time periods that you find in books and tables. This means pay attention to the major age groups only: 1 month, 6 months, 9 months, 12 months, and 24 months or 2 years. We can also throw in 3 and 4 years to be fancy. Now let's start from the 1 month to the 1 year time span. After 1 year, the goal is to have a toddler who can walk by him or herself, gross motor skills, use a 2-finger pincer grasp to pick up objects, fine motor skills, say mama dada, language, and imitate a parent, social cognitive. If you choose to remember one set of things, I would remember just these 4 things. On the flip side to the 1-year-old is the 1 month toddler who can barely do any of this. Imagine, a 1-month-old can only lift their head when prone, track things with their eyes, coo, and recognize their parents. One caveat, which I hope will not throw you off too much, is that while walking is strictly a 1-year thing, the 1-year-old who can't walk is not necessarily delayed. What you will be given on a test, however, is the 1-year-old who can only sit up, i.e. who hasn't even passed the 9-month milestone that you would call delayed. Now, if you understand this, it's easy to remember the stuff in between, or at least it's easier to guess. 6 months is the halfway point between 1 month and 1 year. It's also the halfway point between lying down and standing unassisted, which you might guess is sitting. It's also the halfway point between being able to use 2 fingers to grasp an object and not any fingers at all, which we will inventively call the raking grasp, or using one's hand to move an object. The 6-month-olds are 1 step up from cooing, but can't say mama, which means that they can just babble. And finally, not only do they recognize parents, they've also learned to recognize strangers, i.e. have stranger anxiety, which is one of the big cognitive time points at this level. Now for the 9-month-olds. Going with our approach, 9 months is halfway between 6 months and 1 year. The midway point between sitting and standing is being able to stand with assistance. For fine motor, 9-month-olds can use 3 fingers. Again, not raking with 4 fingers, but not the fancy 2-finger grasp. Language doesn't follow exactly the rule per se, as the early birds can say mama, dada, but being able to say this or not say this doesn't mean anything at 9 months. This also means that language at this age is usually not tested on exams. And finally, the 9-month-old can not only recognize, but they can interact. They can wave bye-bye and play pat a cake, which you could perhaps think of as less complex than imitating a parent. Again, this is not a ton to memorize, but knowing just this will get you really far. In my opinion, the 15-month and 18-month marks are pretty low yield, but you can still use the same strategy. If you remember the 1 year and 2 year marks, then you can figure out everything that should fall in between. Exams usually don't test these months, and on your rotations, you can ask the parents what new motor, language, social skills the child has developed since 1 year, and using the 1 year milestones you memorized to help prompt them. Then you can go to your attending and tell them whether they are or are not meeting the milestones with just the 1 year and 2 year information. The next big category is the 2, 3, and 4 years. These tend to be easier because the numbers correlate well. 2 years is the year of 2s. 2-year-olds can walk between 2 steps, i.e. climb steps, say 2-word phrases, and follow 2-step commands. Motor does fall out of favor with these 2-year-olds because they can stack 6 cubes instead of just 2, but basically think of them as just being able to stack a bunch of cubes. 3 years is the year of 3s. Tricycle, 3-word sentences, and they can also brush teeth. 3-year-olds can copy a circle, which kind of throws everyone off, and I'm afraid this might need to be memorized. However, in reality, i.e. in the clinic, many of the 3-year-olds were drawing much more complex things than just circles. One nice pro, which I did learn from my preceptor, is that for fine motor skills, kids should be able to roughly draw a person with at least as many parts as their age. So a 3-year-old can draw an outline of a face with eyes and a mouth. 4-year-olds will be able to add a nose to this mix. And finally, the 4-year-old can hop, copy across, and play with other kids. So this is my attempt at a picture mnemonic. You can picture the 4-year-old, whose legs look like a 4, hopping along boxes with crosses next to other kids. Again, this is a very bare bones approach to learning these milestones, but hopefully this made a bear of a table to something slightly more digestible. For those who like to memorize or are interested in PEDS, at least now you have a good framework for memorizing the rest. Now for the take-home points. These are the bare minimums to know. 6 months, sit up, raking grasp, stranger anxiety, babbling. 9 months, between the 6-month and 1-year mark, they can walk with assistance, 3-finger grasp, way bye-bye, pat a cake, and possibly say mama dada. At 1 year, now they can walk, use a 2-finger grasp, say mama dada, and imitate a parent. 2 years, 2-word phrases, 2 steps, 2-step commands, and stacking cubes. 3 years, 3-word sentences, rides a tricycle, brush his teeth, and circle drawing. Sorry, you have to memorize that. And finally, 4 years, they can hop, copy across, and play with others. Just try to remember the silly picture mnemonic I drew. Thank you.